Hey there, medical professionals. Today, I'm diving into how helium is revolutionizing the management of stridor. Stridor, as you know, is a high-pitched wheezing sound caused by disrupted airflow. Traditionally, we've relied on oxygen therapy and corticosteroids, but helium is now taking center stage. So, why helium? Helium is less dense than air. When mixed with oxygen to create heliox, it significantly reduces airway resistance. This makes it easier for patients with obstructive conditions to breathe. The result? Improved airflow and reduced work of breathing. Physiologically, helium's low density means it can navigate tight spaces within the airway more efficiently than nitrogen-heavy air. This is particularly beneficial in pediatric cases where airway diameters are smaller. Heliox has been shown to improve ventilation and oxygenation in critically ill patients with stridor. Now let's talk about the practical aspects. Administering heliox is straightforward. It involves a standard face mask or nasal cannula, and most modern ventilators are compatible. However, always monitor the patient closely for any signs of hypoxia or respiratory distress. In summary, helium is proving to be a game-changer in stridor management. Its unique properties enhance airflow and reduce respiratory effort, offering a valuable tool in our therapeutic arsenal. As always, consult with your respiratory therapist or pulmonologist when considering heliox for your patients. Thanks for watching. Stay tuned for more updates on innovative treatments in respiratory care.